thank you so much for coming over. Yeah, like I said over text, I just needed somebody to practice my practical on. Yeah, so in like nursing school, sometimes our exams are called practicals, and you have to pretend you're working and perform an exam on a patient, and someone's judging you and making sure that you're doing everything right. Yeah, and so they encourage us to practice on our friends and things like that. So thank you so much. Let's see. Yeah, I'm wearing my scrubs and everything. Kind of want to get in the zone, My practical's tomorrow and I'm pretty nervous. It's my first one. Yeah, no, nursing school has been kicking my butt. It's way harder than I thought it would be. How about you? How are your classes going? Yeah, that doesn't sound too fun either. Okay, well, no, you can stay seating on that stool. I have all of my things here and kind of a checklist on my iPad. So I'm just going to be running through this and, trying to remember what to say and everything before we get started. Do you want like water or a cup of coffee? You're good? Okay, well, let me just put my stethoscope on and let's see. Okay, yeah, you look perfect. Okay, thank you so much for doing this. It should be kind of relaxing. I don't know about you, but I like going to the doctor and kind of getting my physical. Yeah, it's like soothing, so I'll be talking quiet to make it not like weird. It's already gonna be weird because you're not actually here for an exam. It's just like make believe, like when we were kids, Okay. So I'm gonna walk in the room, and you're going to be a patient in bed in the hospital, and I'm gonna be your nurse essentially. Okay, so pretend to be sick, okay? Okay. Well, my name is Sarah, and I will be your nurse today. Can I go ahead and confirm your first and last name? Great. And your date of birth? Okay. I'm just going to check your armbands to see if you have an allergy band or a fall risk band or a DNR band, and just confirm your identity too. So let me see your hand here. Okay. Yep. Let's say you have a fall risk band. So that means I need to be very careful, and you need to be very careful when standing up, because you are at an increased risk of falling. So let me circle that. All right. And are you on any fluids? Okay. Let's say you're on saline. All right. And your rate. Yeah, the flow rate. Okay. Let's say milliliters per hour. Okay. Are you a smoker? Okay. Are you a drinker? Okay. How many drinks a week? Okay. Per week? Yeah, like a shot is one drink, a beer is one drink, etc. A small glass of wine. Okay. All right. How are you feeling? Just want to make sure you're feeling okay right now. Okay, a little bit of pain. On a scale of 1 to 10, where would you place that pain with 1 being like really mild discomfort and 10 being screaming, crying pain. Okay. Alrighty, well I can check when your last pain medication dosage was. Alright, so you're not quite due for another one yet, but as soon as 30 minutes passes, we can get you another dose. Okay, so now I'm going to take your vital signs. This is kind of the fun part. These scrubs have so many pockets. Okay, let's see. I'm going to put my gloves on first. I really did bring everything for this. Don't I look like a real surgeon or something? Okay, so do I have consent to touch you? I'm just going to look at your face and make sure everything looks okay. So you're not feeling feverish or anything? Great. Well, let's go ahead and take your temperature. So, open up. Okay, 98.6. Perfect. I'm going to write that down. Right, and I'm going to take your blood pressure. So if you could uncross your legs. Very good. And which arm? Do you have a preference? Okay. So I'm going to wrap that around. Then okay. Looks good there. Let me just jot that down. Okay. Alrighty. Then I'm going to take your pulse here in a second, the old school way. Just going to feel your wrist and then look at a clock and count how many beats there are per minute. Okay, so let me see. Let me just make sure that I'm not forgetting anything. Okay, here, I kind of forgot to check your alert. You're looking at me, looks good. Your face doesn't look droopy or anything. Okay. Your hair looks good and shiny. Perfect. Okay. Alright, so let's go ahead and take your pulse. So go ahead and give me your arm. I'm just going to find your pulse really quick. Okay. And then I'm going to count to 15 in my head and then just times that by 4. Okay. too. I'm going to write that down like that. Alright. And here's where I would check your oxygen too, which is that little finger clip that you get put on at the doctor's office. That also checks your heart rate. It's a bit easier than counting. Let's just say your oxygen is 99% or something, okay? Okay, so to be extra thorough, I'm going to listen to your chest, make sure everything sounds okay in there, have you do some deep breaths. So, okay, so deep breath in. Great, and again. Perfect. I'm gonna do it on this side. Deep breath in. Wonderful. Okay, I'm just gonna put it on your back. And then, can you cough? Yeah, just right over my shoulder. Sounds good. One more time. Beautiful. Beautiful set of lungs. Congratulations. Alrighty. I'm going to touch your face a little and you tell me if you feel any pain or anything, okay? Like your neck. I'm going to check your thyroid, make sure it's not swollen. Okay. I'm going to lift your eyelids up. And then pull down. Looking good. Still no pain anywhere on the face, right? Okay. Alright, the eyes, the nose. No issues with the sore throat or anything, right? Okay. Well then now I'm going to do a couple eye reflex tests just to really make this a thorough exam. They can kind of ask you anything during these practicals, so I need to be very prepared. Okay, so here's my light. I'm just going to hold. Can you look at my face? There we go. Just keep looking at my face. Okay. So I'm just going to come at this eye from an angle and look at it from the side. Can you stare at the shoulder? Wonderful. And then stare at this shoulder. Okay. I'm just going to lift this eyelid up. Great. Okay, so go ahead and stare at this. And follow it with your eyes. Great. Okay, keep staring at this. Yep, just making sure that your eyes go crisscross. Alrighty. So I'm going to do one more quick test. So can you tell me? Okay, stare at my nose and then tell me when you see one of my fingers moving, okay? Good. Good. Yeah, just tell me which side you see it. Beautiful. Well, your eyes look great. I'm going to take a peek in your ears, make sure there's no swelling or anything like that. They gave us a kit to use for our exams, but I actually had to buy a lot of stuff myself. Just like a teacher, you know, there's a lot of professions out there that irresponsible for buying your own tools. I think it's silly. Okay, so I have this tool here and I'm going to look in your ear. Just going to pull your earlobe down. Might be a little cold. Alright. Looks good. You have very clean ears. Pulling this earlobe down and checking inside it. Looks good. I'm gonna lift up your nose and just super quickly take a peek in there. Can you take a deep breath in through your nose with your mouth closed? Okay, so no congestion. Let's go ahead and look there. One nostril and then one nostril. Wonderful. Everything looks good, though I am going to look in your mouth as well. Okay, open up. I'm going to compress your tongue with this. Can you really yawn? Yeah, there we go. You got it. Okay. Throat doesn't look red or irritated. Your tonsils look the correct size. Alrighty. Well, let me just check my checklist and make sure I'm getting everything done. Okay. Okay, so let's see. So your vision. Okay, check your vision. Your breath sounds. They were equal and deep. Adventitious sounds. Okay. Shortness of breath, no. Heart rhythm, regular. Rate is good. Alright. Do you want to check your vision really quick? We'll just go through an easy version of that really quick. So I have this cheapy piece of paper, but can you go ahead and cover one eye and then tell me which letter you can read? Hmm? Hmm? Great. And then cover the other eye. Beautiful. That gets a little too small though. That's still really good. Okay. So I did forget to check your pupil reflexes. So this is what practice is for though, right? So I'm just going to make sure when I look in this eye, this pupil dilates and then this pupil also dilates at the same size. Okay, they look the same size, so that's good. Alrighty, so we're gonna skip the hearing test because my professor told me that for sure wasn't going to be on there, on the exam. So let's see. So any pain in your arms? Let me just feel them. They look good. No issues with the skin. And then your neck. Okay. Well, let's do some facial expressions just to make sure all the muscles in your face. So can you raise your eyebrows really high up? Wrinkling your forehead. Then puff out your cheeks. Okay, and don't let me push the air out. Okay. Can you frown? Smile. Alrighty, and make a kissy face. Perfect. Everything looks good there. So no pain in your arms. Can you raise up your arms? I'm going to push down and don't let me push down, okay? Okay, the other one. Perfect. And then the same with your shoulders. I want you to hold them, shrug them up, but I'm going to try to push them down, okay? So, great. Other one. Okay. Any urinary issues? Great. Any nausea or vomiting, tenderness? Let's pretend you have some tenderness, and I'm going to listen and like press on your tummy a little bit. But your arms are looking good. You can really trust the patient for when they notice changes in their body. So, no one will know better than you on if you're experiencing any mobility issues or pain or things like that. So just asking the patient will reveal a lot. Are you pooping okay? Are you passing gas okay? Great. Alrighty. Well, then I'll just listen to your stomach, and then I think that's good enough for this practice exam with you. I actually have 3 more friends this next week that I'm going to do it on. Yeah, I'm just overstudying, I think, a little bit, but, this is going to be a large part of my job, so why not get really good at it, Okay, so I'm going to listen to your stomach, and then I'm going to press on it and just tell me if there's any pain, okay? Alright, just breathe normally. It's a little bit cold, right? Then kind of on your side here, like that. Your stomach's actually making a lot of noise. All normal, though, all normal. Well, except for being a little noisy, your tummy sounds great. So I'm going to just press really gently and tell me if you feel any pain. Yeah, can you sit up a little straighter? Normally I'd have you lay down, but my bed is all covered in clothes. Okay? And then when I press from the back, okay, I'm gonna hit it a little where your kidneys are and tell me if there's any pain, okay? No pain? Okay. Alrighty, I think that is it. Your fluids are good. You're comfortable in your nursing hospital bed. Temperature's good. Is there anything you'd like me to ask the doctor when I see him next? Yeah. Okay. Well, there we go. Thank you so much for letting me practice on you. Did you know my mom was a nurse? Yeah. Well, she was a nurse when I was 10 years old or so, and I would love when she would practice her exams on me. She would come over with her and all her friends, and they would come over to our house because they needed a child to practice their pediatric exam on. And so my mom was one of the only nurses at the time with kids, and so they would all come over and take turns doing physical exams on me when I was a little baby or kid. And it's I would be so excited every time they would do that because it was so tingly and relaxing. Yeah, so I wonder if maybe, you felt the same way. Yeah, exactly. It's just, kind of relaxing. Okay, well, if I need you again, do you think I could hit you up? Yes, okay. Yeah, because we have a bunch of different practicals we need to study for. Exactly, exactly. And just doing them over and over again helps me be comfortable. Even as we progressed through this one, I got more calm, you know. I don't know. I'm sure with time it'll get way easier. Okay, can I give you another hug? You're more than welcome to hang around, of course, but I'm going to probably keep studying. Okay. Thank you so much. Thank you. Okay, alright. Well, wish me luck. Okay. Bye.